So, healthcare is very expensive and it is needed in the country all around and in today's society. Many people can't afford it in America, which is a huge problem because it's overpriced and it's extremely, extremely expensive. But so my main point is the satisfaction of healthcare. So, several factors can affect healthcare customer satisfaction, including actual outcomes after service or treatment, attitudes of caregivers such as doctors and nurses, and the cost of services as well. So the outcomes after service or treatment, it always feels great going to the doctors and coming back feeling that the doctors cared about you and your health and how you're doing, to show like they actually have like empathy and like showing emotion to you. Also, the use of patients reported coming is an essential aspect for improving clinical care because it enhances and connects among doctors and with their nurses. So good feedback to the doctors and everything like that, so they know like how they can help you as well. But if you have good communication with the doctors and nurses, they can get things done for you in the right way, and then the healthcare would be worth your money to spend. Even though it's very expensive, it'll be worth the money. Health professionals are increasingly encouraged to involve patients in treatments decisions, recognizing patients as experts as well as quality of care. Quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. It's proven that if you have great communication with your doctor and nurses, then you'd be more satisfied as a customer because it's worth your money at the end. And then also about attitudes of caregivers such as doctors and nurses. So technically, poor attitudes of nurses resulting in poor patient care could severely undermine the ability of the health system to provide quality care and improve outcomes for patients. It is recommended that all hospital ask nurses attitudes to like basically check their attitude and not to be like rude, because there's a lot of people in help that need to feel like there's a positive environment instead of being negative, because your attitude as the caregiver can make a difference in how your patients feel. It'll help them feel they're being cared for with compassion. So a positive attitude can be infectious. A positive attitude in healthcare professions can also impact your actual job performance. A good nurse-patient relationship reduces the days of hospital stays and improves the quality and satisfaction of both. Doctors and nurses showing empathy. Research has shown empathy and compassion to be associated with better quality to medications, decrease in malpractices cases, fewer mistakes, and increased patient satisfaction. Expressing empathy, one patient at a time, advances humanism in healthcare. Expressing empathy is highly effective and powerful, which builds patients' trust, calms anxiety, and improves health outcomes. Research has shown empathy and compassion to be associated with better adherence to medications and all that. So the cost of services, though. The cost of the services in the United States have gone up by $10,000 a person in the past years, which is absurd, in my opinion. I feel like you're overpaying just to be healthy. U.S. healthcare spending increased 3.9% to reach $3.5 trillion, or $10,739 per person in 2017. For example, there's an employee that covered his family-sponsored insurance plan. According to Peter Tracker, a non-profit focused on measuring healthcare costs, an average family will spend approximately 11% of their gross income, or $8,200 per year, on healthcare costs. The U.S. is one of the most expensive countries with healthcare. However, even as high-income country, The US spends more per person on health than comparable countries. Health spending per person in the US was $10,966 in 2019, which was 42% higher than Switzerland, the country with the next highest per capita health spending. Recent developments tell us that the United States will spend 18% of its gross domestic product on healthcare in 2020. The United States has the highest health spending based on GDP share among the developed countries. And then also, one of the main topics is patient satisfaction. So patient satisfaction is very important and needed because that's how your patient is comfortable with you instead of them being scared or uncomfortable. It's to the extent to which patients are happy with their health care, both inside and outside of the doctor's office. A measure of care quality, patient satisfaction gives providers insights to various aspects of medicine, including the effectiveness of their care and level of empathy. The patient need to be felt as if they were really cared for by the doctors, nurses, and other staff members. If your patient's very unhappy and feels like they're not getting the care and that they feel like they need, then they'll drop everything and stop. And they would say that their healthcare is not worth it. So in conclusion, in a nationality representative sample, higher patient satisfaction was associated with less emergency department use, but with greater inpatient use, higher overall healthcare and prescription drug, and increased mortality. So overall, healthcare is very expensive, and the patients should feel like they're being cared for, and that the doctors and nurses and other staff members actually care for them and want to make them feel better.